Well, you know, it was about 1 year ago, around this time in November, Metro Detroit had already seen an unprecedented spike in cases of RSV that was filling pediatric intensive care units.
That was really intense. So now the question tonight is, are doctors seeing any concerns this year? How is the respiratory virus season shaping up? And so for those answers, we turn to Dr. McGeorge, because you're in the ER, you're seeing what's happening, and do we need to be concerned?
Well, so far, so good, Karen and Damon. So here's the thing. You know, last year, early and overwhelming RSV increase was attributed to the fact that it was the first winter out of COVID precautions, and most younger kids' immune systems simply had not been exposed to RSV. Now, thankfully, at least with RSV this year, everything appears to be more normal, although, according to the CDC data, flu season is definitely underway in the South.
Last year, we called it the triple-demic. This year, it doesn't feel quite so bad.
Dr. Rudy Valentini, Chief Medical Officer at DMC Children's Hospital of Michigan, notes, although the most recently released data from the Michigan Department of Health and Human Services shows RSV is at an elevated level in Southeast Michigan, it is nothing like last year.
I think that there is a lot more community immunity to RSV in 2023 than there was this time last year. We tend to really get most of our RSV probably coming up on Thanksgiving and then through December, early January. It starts to lose some steam usually by early February, and then kind of wanes by March. It's usually done.
Meanwhile, according to the latest CDC mapping, influenza activity has increased significantly in several southern states, particularly Louisiana, Mississippi, Alabama, Georgia, and South Carolina. So far, Michigan influenza activity remains minimal.
I think, typically flu starts picking up probably come December. We are starting to see some uptick of activity. As I look at our numbers, we're seeing just a little bit more flu A that comes through our emergency departments in the last couple of weeks, but still minimal activity at this point.
Still, Dr. Valentini points out it's early.
So far, so good, but we could have trouble coming around the corner. I'm not as worried about RSV, but I think influenza could get us if we don't get ourselves vaccinated.
Now to Dr. Valentini's point, probably because of vaccine fatigue, compared to the past 5 years, this year has seen the lowest flu vaccine uptake so far. And statewide, we are only about halfway to our goal number of vaccinated people in Michigan. So depending on the next couple of months, I agree, this could prove to be a pretty tough flu season.
And you got flu, then what about COVID? Are you seeing a lot of cases? Because normally it seems like right about this time it starts to spike up.
Yeah, they may be picking up a little bit, but honestly, so far, I would say COVID levels have been pretty steady at what I'd call a consistent low level. There are occasional blips in the numbers, but so far it's been completely manageable. And I really just see COVID now as sort of a normal background activity at this point. Now, that's not to say people shouldn't be aware, but nothing is really jumping out at us yet.
Yeah. And you're working the ER this weekend.
I sure am.
You're going to be busy.
Sure will be.
Thank you, Doc.